Good afternoon once again. Today is Friday, the 29th of January 2021, and this is the English language summary of the daily press briefing here at the Center for COVID Situation Administration, or CCSA, as we have done for the past few months. So first off, with the general situation and the number of cases that we have for today, 802 cases are from the new confirmed cases. Out of this 802 cases, seems like a high number, but of course, as in the past few days, the majority of the number is actually from active case finding, most especially in the factories in Samut Sakhon province. So out of the 802 cases that we have recorded for today, up to 692 are actually from active case finding. And there you have an English language slide up for you on screen. The number of recoveries that we have recorded for today is 109. The total cumulative cases since last year in Thailand has been counted to over 17,000, with over 11,000 recoveries. No new fatalities, making the number of fatalities remaining at 76. So therefore, in the sum of it all, the active cases are still under treatment currently in Thailand at the moment, we have 5,551. But mind you that most of these numbers of people still being treated were found through active case finding, so therefore they were placed directly into treatment, into the quarantine system. So over 5,000 active cases in Thailand. Just some observations. You may have seen in the news recently that Thailand has actually been lauded and been ranked quite favorably, quite high in various rankings. The most recent one is a ranking by Lowy Institute of Australia, where Thailand was ranked number 4 in the world, compared to other countries in terms of managing COVID-19, with New Zealand topping that list. And in the list also includes Vietnam. And for Thailand, we're 4th place in this ranking. So that's some good news to hear. Our efforts still have to continue despite this ranking. So one observation is also that you may have heard about the flexibility, the relaxation of measures that we will be having very soon. And I'll talk a bit about that shortly, because this morning we had the general CCSA meeting, the big CCSA meeting, wherein the Prime Minister Prayut Chan-o-cha was the chair of the meeting as director of the CCSA. And we talked about the various relaxation measures. The one point which the Prime Minister raised was about schools. He was aware, he spoke about his awareness about school reopening, acknowledging the concern of guardians in that sense, of parents in terms of school opening. And of course, the mode of teaching may be on-site, online, and on-air. So that will be addressed. One issue discussed during the CCSA general meeting was also the consolidated vaccination plan, wherein that will be updated and finalized by the National Vaccine Committee very soon, around next week. So the CCSA committee, the CCSA general meeting, chaired by the Prime Minister this morning, approved various relaxation measures as proposed by the various subcommittees. And I'll go through this for you. Basically, firstly, it's about the adjustment of the zoning control areas. So Bangkok and the provinces have been zoned, as you recall, in various types. It was like highly controlled, under high surveillance, and the like, or level 1, level 2, level 3, level 4, or by color zone. Now, the CCSA committee meeting today regrouped and adjusted and updated this list. And as you can see on screen, basically there are 5 groups now, and the dark red group, as you see on the bottom of the bar of the screen, actually has only one province now, which is Samut Sakhon province. The one in red has the provinces mostly in the central area of Thailand, including Bangkok and the like. And you see a corresponding map there that increasingly there are more of the green and yellow provinces, so to speak, now. So just to recap the number of provinces first in these categories, is that first, the maximum and strict control zones, the dark red areas, as I mentioned, that has Samut Sakhon. The maximum controlled zones, just now was maximum and strict control in dark red or maroon. And then after maximum and dark red, we have maximum only, maximum controlled zones in red, Bangkok, Samut Prakan, Nonthaburi, and Pathum Thani. So 4 provinces in that regard. The control zones, or the orange color ones, total of 20 provinces. 12 provinces in that group are from the north and central part, and 8 provinces from the eastern part of Thailand. You see orange there on your screen. And then the close surveillance zone has a total of 17 provinces, and that is in yellow. 17 provinces in yellow on screen. In that number, 17 provinces, there are 6 provinces from the northern part of Thailand, 3 from the northeast, and 8 from the central part and the southern part. And lastly, the green zone, as you can see on screen, it's the surveillance zone, which has the most number of provinces, 35 provinces. And from these 35 provinces, within that number, 35, it is comprised of 11 provinces in the north, 17 in the northeast, and 7 in the south. And you can see the corresponding map of each province there. And of course, more detailed information can be found in our information websites and CCSA Facebook page as well. So as for the various measures for each group, I'll just go through that briefly. Firstly, for the maximum and strict control in dark red or maroon, which is only Samut Sakhon, various establishments remain to be closed. For example, gyms, gambling places, of course, public transportation remain to be closed. For that group, Samut Sakhon, flea markets and takeaway restaurants allowed until 9 p.m. only. Shopping centers allowed open until 9 p.m. Only. For the next group, which is the maximum controlled zones, or the red zones, which is Bangkok, Samut Prakan, Nonthaburi, Pathum Thani, the schools will reopen with appropriate preventive measures. School classes in Bangkok and these provinces mentioned will be on-site, online, and on-air according to what is appropriate for the curriculum. It will also include schools for international schools as well. So international schools in Bangkok are in this group, which will reopen according to this new measure. So this will be for the 1st of February. In this group, the red group, dine-in restaurants are allowed to open until 11 p.m., but not pubs and bars. Of course, these dine-in restaurants are limited in terms of the number of people and tables. And of course, no alcohol, only takeaway alcohol. In various areas, of course, dancing and intensive interaction is limited. And the attendees for conferences and seminars in this group will be limited to 100 persons at a time, while boxing matches are allowed without spectators, including for spas and gyms. The various measures have to be abided by very strictly. In this red group, which is also in Bangkok, as I mentioned, the massage parlors, pubs, bars, karaoke, gaming places remain to be closed. And for shopping malls, it's open, no problem with that, but no intensive interaction or promotional programs which would call in too many customers or congested attendance. So for the orange group, which is the controlled zone, as you can see on screen, totaling 20 provinces. All schools open. The alcohol sales is restricted, and then the various restaurants open until 11 p.m. Only. Must include physical distancing. And it's quite similar to the red. The orange one is quite similar to the red zone requirements. Other conditions, same as the red zone or maximum controlled zones. For the yellow or the close surveillance zones, which has 17 provinces, restaurants, pub, bars, and karaoke open until midnight. The massage parlors open with limited customers. Attendance at conference will be limited to 300 people. That's more than the red zone ones. This is the yellow zone, sorry, which is up to 300 people. Boxing matches allowed with limited spectators, and other conditions the same as the control zones or the orange zone. So the yellow is a little bit similar to the orange, but of course more relaxed. And the last, the surveillance zones, which has 35, the maximum number of provinces. Conditions same as the close surveillance or the yellow zones. That's the zones which are of least worry. So basically, this is just to recap the measures in the different color zones. It might seem like a load of information, but just look at what applies to your province, and of course check with the local authorities as well. This is just to have you receive a general picture of the measures in particular provinces. Nevertheless, we have to be remaining self-disciplined. We have to remain vigilant so that we all will not have to return to the strict measures, the various containment measures, the stringent measures once again, which will of course make our lives kind of easier if we don't have to return to very strict measures. Now, all these categories that I mentioned, the new zoning, new classification, new placement of updating of provinces in various categories, this has passed as policy in the CCSA meeting this morning already. And this will be announced publicly in the Royal Gazette soon. And this will be for implementation from Monday, the 1st of February 2021 onwards. So just additional information is that on the information from the World Health Organization on which COVID test do people need? What are the differences of each COVID test? There was an inquiry on this on social media about the efficiency of the RT-PCR test. We received that from the English language social media platforms and inbox that we read every day. The World Health Organization has come up with information on this matter. There are 3 methods of tests, which are firstly the antibody type of test, the RT-PCR test, and the antigen test. Each method has its own strength and its own constraints as follows. So for the antibody test or the serology test, you would have to have your blood drawn from or do a finger pick. And it tells us if we have had the virus in the past, not if we currently have the virus. And there's no evidence yet to tell you if you are protected. The RT-PCR test, on the other hand, tells you if you are infected right now, currently. It's the results of this kind of test is highly accurate with 1 to 3 days waiting time to receive the results. It involves swabbing your nose and throat. And for the antigen test, it tells you if you are infected now, currently, involves swabbing. The results are quicker but less accurate than the PCR. So therefore, the RT-PCR test is the most commonly used type of test, and the results are highly accurate. So this is just your information as per the inquiry that we received. So just before ending, I'd just like to quote something that the director of the CCSA mentioned in the meeting this morning. The Prime Minister, as the director of the CCSA this morning, said that while we are fighting off COVID in this situation together, all of us each and every one of us are indeed all heroes. We are all indeed champions. And we're all indeed persons of courage in this fight together. So in Thai he said ในสถานการณ์ที่เราจะสู้โควิดตอนนี้นะฮะทุกคนเป็นพระเอก All of us are heroes, champions, and persons of courage. Let's keep the strength. Let's give us each other more power to continue to ward off COVID until the numbers reach 0. So hoping for your participation, hoping for your cooperation in all of this so that we'll be healthy and safe in the days and weeks ahead. So thank you very much for your attention and we'll see you again tomorrow. สวัสดีครับ